So you were likely just notified that this webinar is being recorded, and I will touch a little bit more on that in just a moment. While we wait for a few more people to come in, I'm going to start sharing my brief introduction slides. So our webinar series is generously sponsored by Virginia Housing. I will be sharing a link to our Governor's Conference on Aging website page in the chat momentarily. And I will also be sharing other helpful links to our YouTube page where you can find all previously recorded webinars and this webinar in just a few days to come, and some other helpful information. We're so glad to have Lana Sargent and George Worthington with us this morning to present Virginia's new dementia state plan. I think it will be a really informative and engaging presentation. So I'm really appreciative of their time this afternoon and for you all for joining. We really do encourage questions, but please submit your questions through the Q&A box versus the chat box. That will just help us keep track of all inquiries. But there will be times where our presenters will ask you to engage in more open-ended questions in which you can drop those in the chat box. We'll also be doing some polls, so keep your eyes peeled on the screen for those that will populate on your screens. And also during the more formal part of the Q&A, you feel free to use the raise hand feature to request to be unmuted if you'd prefer to ask your question orally or verbally. So keep your eyes peeled on the chat. I'll be dropping some helpful links, but I will hand it over to our wonderful presenters. Thank you everyone for joining us.
Thanks, Jillian. Hi, everybody. I'm George Worthington. I'm the Dementia Services Coordinator with the Department for Aging and Rehabilitative Services. Lana?
Yes, hi, everyone. Thanks for joining us. We're happy to have you here today. I'm Lana Sargent, Chair of the Alzheimer's Commission.
Okay, so we're going to kick off this webinar on the Dementia State Plan 2024 to 2027 with a few poll questions for you. So we're going to ask you whether you attended last year's Virginia Dementia Capable Summit. Did you attend our session? So Lana and I presented a session on the Dementia State Plan, talking about taking the plan, moving from the plan to reality, improving dementia supports in Virginia, where we focused on care coordination programs. Then we're going to ask you how much you already know about the state plan. Some of you may know a lot. Some of you may not have heard about it until this webinar. So that's all good. And then finally, we're going to ask you what sector you're from. So whether you're a healthcare professional or somebody from government or somebody from a AAA or other organization. So a few of you attended the summit. That's great. For the rest of you, hopefully, you'll learn something today. So thanks for joining. So I'm hoping, Lana, that the answers to this are going to be not many people did.
Not many, yeah. As we're doing this, we're hoping to get the message out. It's helpful to have people have heard about the state plan before, but also great to have newcomers to the conversation. This is great.
Okay, so most of you did not get the chance to see us last year, so I'm glad you're here today. So just, I guess, a bit of background on the state plan. The state plan is created by the Alzheimer's Disease and Related Disorders Commission, which has been around for 40 years, which Lana is the chair. And the state plan, we've had a state plan in Virginia since 2011. So most of you know something about the plan. That's great. There are a few that never heard of it before. So Hopefully you'll get quite a bit out of this session. And then we're just going to ask you what sector you're from so we get a sense of who the audience is. So yeah, the first state plan was created in 2011, and this is now the 4th iteration that we published in January. All right, so this is the last question, and then we'll get into the presentation. Okay, so quite a few of you from AAAs, some other government, healthcare providers, and a lot of others as well. So a nice broad range of folks, Lana.
Yeah, absolutely. Thank you for taking the time to do that. It helps us understand who's out there and an understanding of what you've actually experienced with the state plan so far. So it's really helpful.
Yeah. So just to set some context of why we're actually doing this, who are we helping? How many Virginians do you think are currently living with dementia? And I'll ask you to just pop in A, B, or C in the chat. So A would be 110,000, B would be 150,000, and C would be 300,000. So let us know what you think in the chat. Okay. Lots of B's and C's, not so many A's. So, okay, thanks for taking the time to do that. The answer is actually, we don't really know the actual number of people living with dementia. So those numbers are kind of a range. We know that in 2018, so these are 3 different data providers. In 2018, we know that there are roughly 110,000 people with a diagnosis of dementia getting services through Medicare, traditional Medicare. And the Alzheimer's Association estimated last year that there are about 150,000 people living with Alzheimer's disease. That doesn't include other dementias. And in 2019, we asked how many people over the age of 45 were experiencing memory changes that were getting worse over time. And that translated into roughly 300,000 people over the age of 45 experiencing some memory changes that were getting worse. Worryingly, half of those had not talked to a doctor or healthcare provider about their concerns. So really, the state plan is about how to help these folks. I'm just going to talk briefly about Virginia's dementia infrastructure, and then we'll get into the plan itself. So this slide shows you kind of a very brief overview of the agencies and parts of the state government that are most involved with supporting people living with dementia. So you have the General Assembly, which of course makes the laws that support and appropriates the funding that supports folks living with dementia, and then the executive branch. So the governor heads that up, and then within the Health and Human Resources Secretariat, there are 4 agencies that are very involved with supporting people living with dementia. So that would be my agency, DARS, which also supports the Alzheimer's Disease and Related Disorders Commission and looks after the network of area agencies or supports the network of area agencies on aging and the Centers for Independent Living. The Department for Medical Assistance Services, which is our state Medicaid agency, provides much of the funding for supports for people living with dementia, particularly for long-term care. And then the Department for Behavioral Health and Developmental Services, which supports the network of community services boards. And then the Virginia Department of Health, which is supporting the Healthy Brain Virginia initiative or BOLD project. And we'll talk a bit more about that as we go through. And of course, they support the local departments of health. I should also mention the Department of Social Services, which plays another key role. And of course, they support the network of local departments of social services. I'm just going to go a little bit more into depth about the Alzheimer's Disease and Related Disorders Commission and what it does. So as I said, that was set up in 1982. So it's been around for this is its 42nd year. Its role is to advise the Governor and General Assembly on policy, funding, and regulatory issues related to dementia. And it is the creator of the Dementia State Plan, which I said was first published in 2011. The commission updates it every 4 years. And always get my slide timing wrong. So the very first recommendation of the first Dementia State Plan back in 2011 was to create my role, the Dementia Services Coordinator, to have one person who was dedicated to supporting folks living with dementia and helping coordinate services provided by the state and others. Another initiative that the Commission supports is the Dementia Capable Virginia webpage on the DARS website. That brings together resources for individuals, healthcare providers, community services providers, and researchers. So if you haven't had a look at that, please do. There's also a network of memory assessment centers that are dedicated assessment centers that can do full diagnostic workups. So often people will be referred there by their primary care doctor when they need a full workup, meaning usually several different tests to work out what type of dementia they have. And also they do follow-up care and treatment. And then finally, the No Wrong Door Network, which includes the area agencies on aging and many other partner agencies. And this helps connect people to over 26,000 supports and services across the state. So these are the roles and responsibilities of the Alzheimer's Commission. I'm going to just focus on the very last one. So to develop and advocate for Virginia's Dementia State Plan. Actually, I'm going to mention the third one as well. So to develop and promote strategies to encourage brain health and reduce cognitive decline. You'll see why that's important in a minute. So I also just want to highlight our collaboration with the Healthy Brain Virginia Project, which is at the Virginia Department of Health. So this is funding that has come through the Centers for Disease Control and Prevention, or CDC, and under the federal BOLD Act. And BOLD stands for Building Our Largest Dementia Infrastructure. And this is not currently funding, I think, 43 states and territories to improve public health messaging on brain health and dementia risk reduction. And we have, in the current funding, which started just at the end of last year, there are 3 strategies or deliverables in that grant project that are directly related to the Alzheimer's Disease and Related Disorders Commission and the Dementia State Plan. And so one of the strategies is to help maintain or expand our commission. And while the membership is set in code, we encourage other folks to join our work groups, and there are work groups tied to each goal of the Dementia State Plan, so you can see what they are. And if you're interested in joining a work group, please get in touch with myself. The collaboration is also dedicated to educating coalition members and partners on ADRD topics. So in that line, we'll be setting up an educational program for the Alzheimer's Disease and Related Disorders Commission. I expect that will be available to the general public beyond just at the meetings themselves, but this is something that we haven't quite got to yet, but this is under development this year. And then finally, to lead the coalition to develop and track an implementation plan to aid the Dementia State Plan. So this will be something new for Virginia. We've never tied measurable goals or outcomes to the strategies of the Dementia State Plan before. And we're excited about doing this. It's going to be a big effort, but this will help us track the actual accomplishments that we're getting done through implementing the plan and help us see where we need to focus efforts going forward. Okay, with all that out of the way, we come to the plan itself. So what is the plan? So the plan is really a blueprint for Virginia's dementia capability. And dementia capability means having the systems and structures in place to support people living with dementia with appropriate person-centered care, knowledge, and awareness. So it's not just for healthcare providers. It's also including first responders, financial and legal services personnel who would be helping support people living with dementia, and of course, family caregivers and individuals. So the plan includes short, medium, and long-term strategies. So as our first efforts to build that implementation plan, we're currently prioritizing all of the 110 strategies that are contained within the plan into short, medium, and long-term. So short being things that we are already maybe doing or just need a little bit more work and can finish that in a year. Medium term is the things that will get accomplished during the plan period of 4 years. And long-term strategies are things that we don't maybe expect to get fully accomplished during the plan period, but they're important for that blueprint of full dementia capability. And so there are things that we hope to make incremental progress on over the plan period. So as I said, there's 6 goals, 20 objectives, and 110 strategies. We're going to spend the next 40 minutes talking about each one of those. Well, actually, we're not. We're going to talk about one objective from each of the 6 goals in a little bit of detail, and then we'll have time to answer questions. You can download the plan itself from this webpage, vda.virginia.gov/dementia.htm. We also have hard copies for the first time. So if you're interested in getting some hard copies, please just send me an email and I'll get those to you. Okay, I'm going to turn it over to Lana, who's going to talk about the 6 goals.
Right. So as George said, we won't go too deep, but we're going to take a little bit deeper dive. And we'd really like to highlight some of the new aspects of some of the sub goals that we're looking at. And so these are the Dementia State Plan 6 goals. The 1 through 5, what has come together is out of the Dementia Summit that we had, which was really a great opportunity to connect with individuals who are in the service areas for dementia, as well as public comments, and partnering with the commission is how all of this came about. So there were some changes that were made in the 1 through 5 goals, but we want to also highlight a new goal was added this past year. It was very loud and clear, and it came out in our Dementia Summit, as well as I'll be diving into that goal on why we're really focusing on enhancing brain health and addressing modifiable risk factors for dementia. Okay, George. Right. So jumping right into that. So the elevating brain health used to be under goal 2, and we've out of the summit as well as public comment and knowing now that there is good evidence not only in the National Alzheimer's Plan, but the National Institute of Aging around the understanding that in the early phases, or really a lifespan approach to brain health, that we have the ability to make modifications in our lifestyle in order to prevent different aspects of dementia. And so we really wanted to highlight this as its own goal. We want to elevate this focus. It does dispel a lot of mystery around dementia, that it's not a normal aging related process, that people do have some control over this. So it allows us to give that clear message and then elevate the goal itself and put interventions and focus around it so we can help people understand what this means when we say brain health. And again, I mentioned we're taking a life course approach to dementia. So if you download the dementia plan, you'll see this, that all of our work is focused not only in the advanced stages, but in the preclinical phases. This is the new area we're talking about with brain health, things that we can do around education for risk factors and how do people modify those risk factors, putting resources across the state that will help focus on this. And those mainly hit goals 1, 3, and 6 all the way through. Also, we've provided goals and interventions around symptoms, where symptoms emerge. So support for where to start for both caregivers and individuals in the early stages when symptoms start to emerge. Also, living in community. So what are resources for home and community-based services that people can tap into? And then living in care settings and any behavioral crisis, ensuring appropriate supports. And we're doing a lot of work around education in this area too for behavioral crisis. So we're taking a lifespan, life course approach to dementia, everything from prevention to the advanced phases of dementia. In this particular version of and this is kind of a new approach really for this this plan. Go ahead, George.
Yeah, I'll just add that you don't see goal 2 in there, but goal 2 is data, and it really informs all of these stages. And if you're wondering where you fit in, so basically everybody who doesn't have a diagnosis or symptoms is preclinical. So that really starts at birth and goes through any appearance of symptoms. So we're looking to focus lots of effort there, as Lana said, on education and awareness.
Absolutely. Go ahead, George.
Okay. Oh, yeah, that's me. Goal number 1 is about coordinating quality dementia services in the Commonwealth to ensure dementia capability. And this is really about statewide services. Looking at how we can best harness different agencies' efforts and work with community partners to ensure that there's a robust network of services and supports for folks living with dementia and their caregivers. So I'm going to focus on objective 1.1, which really is about my roles. So supporting and maintaining the Dementia Services Coordinator position at DARS to oversee Virginia's dementia capability. As I said, this was the first recommendation of the first Dementia State Plan that this role be created. And it was created in 2013 through General Assembly funds through the budget. And I'm the third person in this role, and it's amazing what has been accomplished over the last 11 years, I guess. So many things. There's still so much to do, however, and getting everybody to work in the same direction and work on the same page requires lots of collaborative efforts, building relationships. And when people ask me what do I do as a dementia services coordinator, the main thing is really connecting people, helping connect the folks who are working on the front lines with people who are making policy, with people who are helping do research into better supports and services and treatments, and of course now working with educators and others to promote brain health and dementia risk reduction. So lots of getting to know folks and helping people connect with each other. Okay, I'm going to turn it back to Lana.
Great. So we do have a very engaged commission. I think that makes the state plan itself much more robust, as we're hearing from individuals and their needs. And one of the other areas in which we collect data to help us understand the scope of what is needed and the impact that the state plan is making is in our data work group. And so our goal 2 is really focused around dementia-related data. This is not easy by any means. I've been on the commission for several years now and been the chair of this work group, and it can be challenged to get statewide data. But I'm going to highlight Objective 2.2, which has been a great collaboration with the commission and the Virginia Center on Aging, Dr. Annie Rhodes, who's really, put the Virginia Memory Project into action here. And this allows us, we are one of now 5 states, I guess I would say, 4 states that have a codified Virginia or state registry. And so in previous times, we would get data either through projects, individual projects that we were working on, or outreach, or the BRFIS data certainly is a place where we can get that data. But drilling that down to the needs of the Commonwealth have been harder for us. And so the Virginia Memory Project is the goal really is to provide this information for policy, economic planning. It helps us plan out interventions and resource allocation. And so as this database grows, we're fortunate to have had it just codified into the Virginia Code, and that will help it grow and get better data in a way that allows us to look at prevalence and geographic dementia across the state of Virginia. What this does is it really helps us direct resources to areas that are in need of resources, and allows us to really plan at a state level that we haven't been able to do. This is a secure HIPAA compliant database. And you can access it through either mobile or desktop access. You can see here, you can self-register, so people can self-register, which many of the questions used in the database are aligned with the BRFIS cognitive decline module. And also the data has been coming in through all payer claims, de-identified data. And that really helps us, again, look at the statewide need, which, again, will be really impactful for our ability to think about the Commonwealth and where the needs are for individuals. And again, going back to that first question we asked you about how many individuals have a diagnosis of dementia or living with dementia, it helps us get closer to the understanding of the need and what that number would be. If you're interested in kind of taking a look at the resources there, you can search the Virginia Memory Project and you'll see it comes up on the Center for Aging. Okay, go ahead.
Dr. Rhodes, Annie Rhodes, has just put the link in the Q&A box. So if you look at that, you can find it. And I'll just mention, unlike the other registries, Virginia's registry is unique in that it involves this pathway to care, which is that self-registration. If folks request follow-up, they'll be contacted by a social worker who can help connect them to supports and services that will be useful for them. And that's unique. So we're really excited about that portion of the registry as well.
Yeah, that's actually the Virginia is the only one that provides that type of service out of the 4 that are out there. And the other thing that it does is we'll connect in with a dementia care navigator too, which we'll talk about how that role is growing across the state. Go ahead, George. Anything else?
Nope.
All right. All right, so goal 3, that leads right into what we were just talking about, actually. The need to not only understand the scope of the statewide prevalence and where the needs are, and potentially kind of where our hot spots are, but also the idea of connecting in with resources. And so this is an area I hope that many of you are starting to hear about, but it's going to be a growing area, and that is the need to promote training for individuals really working in this space. Also, there's a growing need to educate and train community health workers across the state to sort of take on care navigation within the dementia space, which is a unique area of training that is needed. But our focus is really to start to hone in on social service workers to ensure dementia capability. We've always had navigator resources, but really haven't spent the extra effort in making sure the training is also supporting caregivers as well as really connecting with that dementia capability overall.
Yeah, and I just add that the training for community health workers is just been launched. We created 2 modules using the BOLD funds and led by Virginia Department of Health. So those modules are available nationwide, but if you are a Virginia resident community health worker, you can access those for free. You can again, like Lana said, they're going to be working on doing screening but also follow-up care for folks living with dementia. So They can screen folks for cognitive decline, make referrals, and then help provide follow-up care. So a really important part of the workforce.
Yeah, and I would say the last part is just supporting caregivers in that process too. So it's navigation, but not just navigation, it's prevention and caregiver support at the same time. Yep, so elements for a training curriculum, as George was mentioning, really this is for the first time the plan includes these suggested topics for dementia-capable training curriculum. And dementia-capable training, will really should cover this wide range of topics to ensure that individuals and organizations are equipped to provide appropriate care and support to people living with dementia. So individuals with dementia as well as their caregivers, and then really anybody on the lifespan continuum who's interested in learning more about even the prevention of dementia and things they can do. By covering these topics comprehensively, then dementia-capable training programs can prepare individuals and organizations to provide the compassionate, respectful, and effective care for people living with dementia. George, anything else you want to say about that, our curriculum?
No.
Okay. All right, so goal 4, want to focus on again, providing access to quality coordinated care for individuals. It's complex when being given a diagnosis and understanding specifically what your needs are and how to navigate those needs. So I'm going to hone in here on, George, can you highlight the specific objective for us there? So we'll hone in on the promote and support access to dementia care navigation services. This is an area where we're really hoping to see just grow over the next couple of years. And for it to be a statewide initiative, we do have state funding that is supporting a pilot of 2 dementia care navigators at UVA, and that has been come specifically to really anybody who wants them to be available. And George is putting the link to the community health worker modules in the chat now. And then there are quite a bit going on now. We have a dementia state roundtable because within several areas across the state, there are many individuals and health systems that are starting to work on dementia care navigation services and individuals. And so this is an area where one of our goals is to see it become a statewide initiative of support and network. So there's the Richmond Brain Health Initiative in the Richmond area, and a lot of work happening out on Riverside also in this area. So there's really a big need to make sure that we're promoting that support and that we have integration of not only the training, but the resources. So there's equitable access across the state for all individuals and that it's not localized to one area. So this is a really, I think in the next couple of years, really going to be a growing area that you'll see across the Commonwealth. Any other thoughts?
I'll just add, the Commission's been recommending to the General Assembly every year. The Commission delivers a report, an annual report to the Governor and General Assembly that includes recommendations. Last year and the year before, they've recommended funding for a pilot program of 6 dementia care navigators who would be based in initially underserved areas of the Commonwealth, and eventually the vision is that they'll be serving every area of the Commonwealth. And the goal for them would be to provide community education, screenings, and also that navigation support for families and individuals. And really, we're looking to Wisconsin, which has a model similar to this. They developed themselves. They're really a leader in this area, and they have dementia care navigators in every one of their counties. So that would be something that we can aspire to, and getting the plan implemented would help us get there.
Right. Absolutely. Yeah. Statewide resources with equitable access is the ultimate goal. All right, so goal 5, expand resources for dementia-specific translational research. This is actually something that the Commission has supported this program. This is the RDRAF program. So This is Virginia Alzheimer's and Related Disease Research Award Fund. Since 1982, this program has been supported. It primarily focuses on seed grants for pilot projects that can then apply for larger federal grants like NIH opportunities. So an opportunity to really start to make an impact on understanding the disease state itself, as well as interventions around resources for families, as well as individuals with dementia. And I would say even in the prevention and early stages of dementia phase. So the program has seen a $5.33 million competitive award within nearly a 10-to-1 return on investment in the General Assembly. So these are great seed fund opportunities and usually, go right through the General Assembly, and subsequent funding for future research has continued to come from this. This is also an area in which we do collect data. It helps us understand also where the need is. This is another area data resource for us.
Yeah, I would say one of the things that we're doing, or that the work group is working on, is to help support collaboration between researchers across the Commonwealth. And also it's examining ways of helping improve participation in research and educating the public about the importance of participating in research, even not just for folks with a diagnosis, but also for healthy people.
And I'm going to put I'm putting the link right in the chat there for everyone. So
great. Thanks, Lana.
Yeah.
Okay, so goal 6. So goal 6 is our new goal around brain health and dementia risk reduction. I can't tell you how excited we are about this. I think it not only marks a new era in our dementia state plan, really elevating brain health and dementia risk reduction, but it reflects a huge amount of new knowledge. In 4 years ago, when we were doing the last update of the plan, there was stuff known about brain health and dementia risk reduction, but it didn't seem to have the evidence base was still growing, and now the evidence base is very strong in supporting action in many different areas, such as supporting heart health, looking at ways to improve social engagement as a way of reducing your dementia risk, looking at ways of challenging your brain, exercise. All of these these are some of the 12 identified modifiable risk factors, or potentially modifiable risk factors, that were in a report by the Lancet Commission, which is a British medical journal. Really solidified our thinking around dementia risk reduction. And while there have been a lot of developments in treatments, this is still the only leading cause of death that has no cure or really effective treatment. There's disease-modifying treatments, but not treatments that will roll back changes that have already happened. And so I keep hearing, and Lana probably does too, that at this point, prevention is the cure. And so we want to make sure that folks know about how to prevent, or what they can do in their own life to help prevent the changes that cause dementia. So I guess our big initiative here is the BOLD project and implementing the Healthy Brain Initiative. So I mentioned the BOLD grant earlier. That's the grant from the CDC to the Virginia Department of Health. And the goal of that is to integrate dementia risk reduction and brain health messaging into public health more broadly, but it goes beyond that. And it's really about integrating or implementing the Healthy Brain Initiative. The Healthy Brain Initiative is, I think it's been around for about a decade, maybe a bit longer. It's an initiative led by the CDC and the Alzheimer's Association. And every so often, I think it's 4 years, they publish a roadmap, an updated roadmap that contains action steps under 4 different domains. So those domains are P, strengthening partnerships and policies, M, measuring, evaluating, and utilizing data, W is building a diverse and skilled workforce, E is engaging and educating the public. And we didn't show it here today, but if you download the Dementia State Plan, you'll see that throughout the plan, every objective has a list of little codes by it. H4, sorry, not H, M4, W3, E2. So those are action steps taken directly from the Healthy Brain Initiative. And every objective in our state plan aligns in some way with Healthy Brain Initiative action steps. We've also included that full list of action steps and links to the roadmap in the Dementia State Plan. So while we're working to achieve and implement the Dementia State Plan, we're also at the same time working to implement and achieve the Healthy Brain Initiative roadmap. So really excited about this. And you'll see this graphic here, that's the paradigm of the Healthy Brain Initiative with health equity in the center, and then the 4 domains around that. And then on the outside, you'll see risk reduction, caregiving, early detection and diagnosis, and community clinical linkages. So the first 3, risk reduction, caregiving, and early detection and diagnosis, they, as part of the BOLD project, the CDC awarded 3 grants to set up national public health centers of excellence in each of those domains. Risk reduction at New York University, early detection and diagnosis with the Alzheimer's Association in Atlanta, and caregiving at the University of Minnesota. And then community clinical linkages, that's what the state grants for BOLD are really all about. So to foster those linkages between the community and clinics, as well as getting information out into the general public as well. So things like if there's a campaign around diabetes, there should be some information about how treating your diabetes and support and maintaining your health while living with diabetes will also help your brain and help prevent dementia or help lower your risks of developing dementia. And then finally, looking at kind of some broad implications of the Dementia State Plan, excuse me. We're really looking to increase engagement. And as back on the slide that we had at the beginning on the BOLD strategies that align with the Alzheimer's Disease and Related Disorders Commission, we're looking to increase the engagement of the commission with the general public and providers. So the primary way that the commission can do that is through expanding its the number of people working on the work groups. There we go, expand the work groups, and to invite more folks to join those work groups, because that's where the actual work is done. So there are 4 work groups: the data and research, coordinated care, brain health and dementia risk reduction, and training. And those work groups meet every other month or quarterly, and really they are working to achieve specific strategies of the state plan. So for example, some of the things that have come out of work groups in previous years have been the Virginia Dementia Roadmap, which I hope most of you are familiar with. It's our flagship resource for helping support families living with dementia and their caregivers. And then many other resources. One of the work groups developed a primary healthcare toolkit around dementia. And many of those can all be found on the Dementia Capable page that I stuck in the chat earlier. We've talked about the implementation plan, the care coordination roundtable that Lana mentioned. So this is something that we launched in October, and the goal of that was to bring together all of the health systems that are currently providing dementia care coordination services, and also those that are interested or evaluating whether to start providing those services. And the goal there is really to help folks learn from each other, talk about what barriers you might encounter, how we can solve those challenges, and how we can expand those services, including if everybody's working together, then that might be a good forum for advocacy to help obtain the funding to support those services more broadly. And then finally, we're really building on last year's summit to expand stakeholder engagement. So the goal of that summit was to really pull together folks from across the Commonwealth with an interest in supporting people living with dementia and their caregivers, and getting them to have a chance to talk to each other and share their experiences and their knowledge. And we want to continue doing that. So we see that as the start of a conversation that will continue beyond the life of this dementia state plan, unless we achieve everything, which seems unlikely. We can only hope. But the more folks that we're engaged, that the commission is engaged with, and that I'm in my role as dementia services coordinator engaged with, the more we're able to deliver for folks. So really, this is so important, and we're really excited to be moving this forward.
So
Lana,
I'll just say here that, I want to stress the need for work groups. I want to say this is our first dementia capable summit, and it was just the most rich conversations and ideas that really led to what we're presenting you today. This came from public comment, from individuals working in the service industry in this area, as well as just individuals with dementia themselves and their caregivers coming together to say what it is that was needed. And so we need the same sort of synergy and energy. I would say this commission is very collaborative, and also in our work groups, because that helps us translate what was identified at the summit, what you're seeing here today as being the state plan, into action. So please do reach out to us, if interested in any of the work groups that we have.
Yeah. I think that is our last slide. So we've got one last poll. We want to see which goal area most aligns with your work or your interests. Is it goal 1, the statewide coordination? Goal 2, using and improving data? Goal 3, training? Goal 4, coordinated care, including those care coordination programs we've talked about, and dementia care navigation? Goal 5, research? Or goal 6, dementia risk reduction and brain health? And while you're doing that, I'm going to see, Lana, we've got several questions. There's some that are, I guess, are going to be easier than others to answer, so I'm going to address one of those right now. The Alzheimer's focus area located in Atlanta, that's the Public Health Center of Excellence, funded by BOLD, on early detection and diagnosis. So they have a website that you can find. So it looks like goal 4, coordinated care, is the most aligned with folks, but there's people who are interested in every goal area, which is great. So if you're interested in actually putting that interest into practice and becoming part of the work to achieve the dementia state plan, please email me, and I can help pull you into one of those work groups.
It's interesting. The second two were coordinated care and brain health. So that's also a lot of what we saw at the summit too. So that's great to hear.
Yeah. So somebody asked, is there a plan for a 2024 summit? There is not. I know the follow-up questions and surveys to the summit, people were very keen to see something happen on a regular basis. So this webinar is our follow-up for this year. And then we'll be doing more outreach efforts around the state plan this year. We are discussing whether to have a summit again next year, but we won't be having one this year, unfortunately. Let's see, is the plan that somebody asked about the training that we talked about that's in the dementia state plan. Will it be live or recorded? So those training topics, we haven't actually developed a curriculum ourselves, because really that depends on what your area is. So, like the community health worker trainings that we just recently developed are very focused on the skills that the community health workers themselves will need. And those will be different for people in different professions. So for a lawyer, for example, they might need to know some different things. So the topics that we put up there, those 13 topics, were things that should be included in a dementia-capable curriculum in some fashion. So we're not being prescriptive about it, but we're just being suggestive. So I was suggesting what topics ought to be covered. So we're not going to be developing modules ourselves, unfortunately. And there's a question about alternates in place for psychiatric care and TDOs. So going back to that lifestyle, life course model of dementia that we built the state plan around, the last section of that was behavioral crisis, the stop sign. So we know that not everybody living with dementia is going to experience behavioral crisis, but some will. And currently, when an individual is in behavioral crisis, often their only resort is to call 911 or take the person to the emergency room. And at that point, they may end up under a temporary custody order, temporary detention order, a TDO, or an emergency custody order, ECO, and placed on a psychiatric ward because there's nowhere else for them to go. Or they end up in the state psychiatric hospital, which again is the place of last resort. And there really is no alternative at this point. So there is some work. There's a bill in the General Assembly currently that would set up a work group to examine this year how best to set what kind of system should be set up to support those folks in behavioral crisis who really don't belong in the state psychiatric hospitals. What is the role of the CSB for persons with a diagnosis? So somebody with a primary diagnosis of dementia as opposed to mental health, really the CSBs, some CSBs can be helpful. Others won't support people with a primary diagnosis of dementia. It kind of depends on the area. There's some work, some exciting work being done down in Tidewater area. Western Tidewater CSB has set up an assisted living to support people with dementia in behavioral crisis. But it's a small facility. It's really a pilot program. So we'll be looking to see how that works and maybe extending that across the Commonwealth. The CSBs are also involved. So in the state plan, there's not, we're primarily focused on area agencies on aging as a kind of conduit to local supports and services for folks. But the CSBs, Department of Social Services, local health departments also have a role to play. And one of the things that the Commission would really like to help foster is increased collaboration between those agencies at the local level. So what would that look like? Really, it's going to depend on the localities themselves. So we'd love to see some organic things happening in that space to help those agencies better collaborate to better support their local residents.
Absolutely. There's a question about the training, George, on there, whether or not it'd be live or recorded.
Yeah, that was we're not actually creating a curriculum.
Mm-hmm.
So I think we've got all the questions. Were there any other questions? Did I miss something in the chat?
Did answer a few.
And just while we have a minute or two for people to, if you have any questions that you think of in these last few moments, feel free to do so now. I just want to thank our speakers, Dr. Sargent and George Worthington, for being with us this afternoon. I think it was a really helpful presentation. I know that it was kind of a mix of what people knew about the plan to begin with, but overall, I think it was just super informative, and the breakdown of the plan goal areas were really helpful. So thank you so much. And I saw a few comments about the presentation slide decks, and I had mentioned, yes, we will be sending the presentation slide decks in a follow-up email to all attendees in the coming days. Which and I'll be also sure to touch base with our speakers on some of the links that we that they provided this afternoon as well, that might not have been included in the slides themselves. And I know that both of our speakers are willing to provide their email addresses as they are here on the screen as well. So if you happen to think of anything in the coming days that you didn't have a chance to ask this afternoon, I know that they're happy to be of resource. Did any other questions come in, or do you have any other final remarks, Lana and George?
I would just like to say thank you so much, Jillian, and all of you over at the Governor's Conference for being so supportive and helping us present this webinar and also the summit last year.
Well, we're absolutely happy to, and we look forward to working with you in the future. Thank you, everyone, for joining. I appreciate
Thank you, everyone, for being here. Appreciate
everyone's
it.
time.